Hi, this is Dr. Peter Hartmann. This is a video in our series on mental health topics. This one is on anxiety in the time of COVID-19, and I want to thank Susan for recommending it as our topic for today. I'm really going to focus on normal and understandable anxiety in the face of this pandemic. Anxiety is a natural, normal response to threat of any kind, so it is quite understandable. I want to be clear that I'm not really talking about anxiety disorders like generalized anxiety disorder, PTSD, panic disorder, and the like. These are all incredibly important topics, and we'll probably want to do some videos on them in the future. The only thing I'll say about the anxiety disorders today is the fact that they're the most common type of mental illness. Approximately 40 million American adults have an anxiety disorder. And unfortunately, people with an anxiety disorder have often noticed a worsening of their symptoms during this pandemic. So if that's the case for you, please reach out to your mental health professionals. And one of the major factors that's causing anxiety and stress is the fact that we're undergoing substantial change, and typically not for the better. Our lives have been turned upside down. The psychologists tell us that all change is loss. And we've experienced a lot of changes. We have lost our sense of security and safety in the face of the pandemic. Many of the changes are especially challenging. Social distancing has gotten us away from our family and friends and the support that we're used to experiencing. Many of us have had to work from home, and that's a real change in our lives. Our children may be schooled at home. This creates a problem in balancing our need to watch our kids, make sure they're doing their homework, but then also doing our own job. We have to wear a mask, especially when we're inside. We may have lost our job as a result of the pandemic. We might struggle with paying our rent or our mortgage. We may fear losing our home. Perhaps we'll become homeless. These are the sort of things that we would worry about. And the economy has been struggling until quite recently. So these are all sources of stress that are related to changes from our pandemic. And unfortunately, some people have been trying to deal with these anxious and stressful feelings by some unhealthy coping. And these are some things that we shouldn't do. The American Psychological Association actually did a survey recently, and what they found was 25% of respondents said that they were turning to alcohol as a way of coping. Another 61% engaged in unhealthy eating habits and gained significant weight. This was especially true of our millennials, that is to say, people from the ages of 25 to 42 who gained as much as 41 pounds. And 63% of people said that they were not exercising as much as they used to. That may be partly because they don't have access to their gym, or maybe they're afraid to leave the house to jog or walk, but for whatever reason, they're not exercising as much as they should. And so these are some unhealthy responses to the pandemic and things that we want to avoid. Well, what are some things that we can do to help us with our anxiety? Well, one thing is to gain some real perspective on what the real dangers are. We have to keep in mind that most people who develop a COVID-19 infection are either asymptomatic or have just mild to moderate symptoms. It's only a minority, a small minority at that, who develop severe COVID infection. They are mainly in the elderly or people with significant coexisting medical conditions like high blood pressure, heart disease, lung disease, that sort of thing. So the mortality rate, the percentage of people who die from COVID, is actually only 1.8%. So less than 2% of people who develop a COVID infection are going to die from it. So keep that as a perspective. It is very important that we do something about reducing our exposure to COVID-19, partly to protect those people who are at increased risk, but also some of the people who are not at special risk may develop a severe infection. But fortunately, as we say, only less than 2% will actually die from it. Now, the Anxiety and Depression Association of America points out that some people tend to focus on the worst case scenario. You know, they're young and healthy and they're unlikely to experience any significant illness if they develop COVID, but they focus on the worst case where they end up in the hospital and then they die. This is a form of catastrophizing. And if you find yourself doing that, it's just cranking up your anxiety, and you should engage in some good self-talk by reminding yourself of the proper perspective, that the odds of this happening to you is extremely improbable. Now, in addition to looking at this thing from the proper perspective, there are certain practical steps we can do to limit our risks of developing the infection in the first place. So the first obvious one is good hand washing, good hand hygiene, use of hand sanitizers when you don't have access to washing your hands, avoiding crowds, good social distancing, wearing your mask. You don't need to take extreme measures, though. Use these practical measures that are being recommended by the Centers for Disease Control, and you will have done the proper and practical things to help yourself. So what are some things we can do to cope that are good for us? Well, the Centers for Disease Control actually have come out with some excellent recommendations. We need to care for our bodies. So that means proper nutrition. We need to get adequate sleep. For a typical adult, it's around 7 hours at night, but it varies from person to person. We should exercise on a regular basis. That's going to help us quite a lot with our anxiety. It also raises the endorphins, the natural opiates in our brains that makes us feel better. And so it helps us psychologically as well as physically. They also recommend that you engage in enjoyable activities every day. This will help to raise your spirits and help counteract a down mood, but also an anxious mood. And let's not forget that we humans are social creatures, and it's very important that we connect with other people. Now, if you're in a situation where there's a real risk of infection, you can do that through the telephone or using FaceTime or Zoom. But if you have been fully vaccinated and the people that you'd like to be with are also fully vaccinated, you can actually get together in person, and it's not a real concern. So learn to cope in healthy ways. And the final thing that the CDC recommends is not to forget about your normal preventive measures like cancer screening and a flu shot. See your doctor about these things and remain healthy that way. A final suggestion on reducing your anxiety that's mentioned by the CDC, but many others, is to limit the negative news that you watch. They recommend that you only watch the news about once a day or maybe a couple times a week. There's so much information about the problems that may occur from the COVID-19 pandemic that it just raises our anxiety, and it just becomes more and more severe the more news that we watch. So put some reasonable limits on how much news watching you do. Now, a final measure that can make a huge difference in your actual risk, but also making you feel more relaxed and less anxious about this pandemic. If you're eligible, please get a vaccine. They are extremely effective. They work very well to prevent severe disease and death. So even if you would happen to get a COVID infection after the vaccine, it will tend to be mild. The odds that it will be bad enough that you'll have to be hospitalized and even die are extremely low. So vaccination is a very, very important measure, both for you as an individual and for society as a whole. The other thing I'll mention about vaccination and anxiety is the fact that we've noticed that people who receive a vaccine and are very anxious about getting vaccinated, some of them experience some faintness or dizziness after the injection. This is not a side effect of the vaccine. This is you being anxious. and it can occur after an injection for any reason. And it's no more prevalent, as far as I can tell, when you're vaccinated with the COVID vaccines than with, say, the flu vaccine. The final thing I want to mention about anxiety is that there's a new word that I learned that's been developed in the face of this pandemic, and that is coronaphobia, which is an intense fear of the coronavirus. It is understandable, but that refers to people who have an extreme fear reaction. And I believe that if you take the proper perspective, as we've discussed, and use the good coping mechanisms that the CDC has recommended and avoid the negative coping that others have used, you should do fine. So feel free to leave comments, including suggestions for other topics below, and subscribe to the channel if you want to be notified of new ones. And finally, hit the like button below if you found this useful. So thank you, and I hope you have a great day.